Hello everyone, I'm happy to share with you my research paper entitled The Impact of Charismatic Leadership to Job Performance on Health Workers During the Pandemic Mediated by Commitment. This is the research collaboration between Binus University and Unimas University, Malaysia. This is the outline of the presentations. We start with the abstract, introduction, literature review, then method, results, and then discussion and references. We start with the abstract. This study aims to determine the effect of charismatic leadership on job performance with commitment as a mediator for health workers during the COVID-19 pandemic. Respondents of this study were 367 health workers who serve in hospitals, both private and government hospitals, from several cities in Indonesia. The sampling technique used the convenient sampling technique. The results show that first, there was a positive and significant influence between charismatic leadership on job performance. Second, there was a positive but insignificant influence between job performance and commitment. Third, there was a positive and significant effect of charismatic leadership on commitment. And the fourth, there is a positive and significant influence between charismatic leadership on job performance and commitment as a mediator for health workers during the COVID-19 pandemic. We go to the introduction. In early March 2020, Indonesia reported its first positive case of COVID-19 patients, and since then, there has been an increase in the number of COVID-19 patients. Along with the entry of COVID-19 into Indonesia, which later became a catastrophic outbreak, so that the infection spreads rapidly, quite overwhelming for health workers' services. According to COVID19.co.id, the COVID-19 situation in Indonesia on March 2nd, 2020, it was confirmed that the number of people exposed to COVID-19 was 1,347,026, with the details of recovering 1,160,063 and died 36,518. As the front line in carrying out the emergency response to COVID-19, health workers are considered the most valuable assets in the hospital, and their leadership style is one of the determinants that can affect their performance. We go to the literature review. Charismatic leadership style is a leader who has charisma and authority and a mindset that is consistent in carrying out the vision and mission in agency or organizations. Leaders with charismatic leadership show and help their followers to change many aspects for the better, such as their needs, values, preferences, and aspirations, to become more committed to the organization missions and to work beyond expectations. Commitment is an employee's loyalty to the organization. Commitment has many aspects. It includes loyalty, pride, a sense of commitment to work, and belief in organizational values. Job performance is the work output and work behavior of employees in a certain period, which can be measured from the ability to complete tasks and responsibilities of employees at the company. Based on this opinion, it can be concluded that job performance is the achievement of work result produced by employees that can be measured by work indicators that have been determined by the organization's company in accordance with their function and responsibilities. We go to the method. This research method used a quantitative approach with a survey method, which examined the effect of charismatic leadership on job performance for health workers during the COVID-19 pandemic, with a commitment as a mediator. The sampling technique used convenience sampling technique. In this study, The population was health workers who served in hospital, both private and government hospital, from several cities in Indonesia, as many as 367 health workers as the sample of the study. The analysis in this study used three methods. The first will use the four-step indirect impact method. The variable is called a mediator if the variable influences the relationship between the predicted variable and the criterion variable. Second, we'll use the median package. This analysis directly used the bootstrap method. And third, it used the process R package, which is a form of replica and row highest famous process at SPSS or SAS. However, because SPSS and SAS have a weakness because they are not open source, the researchers use the R model. Here is the result. We can see from the table. The result of the analysis showed that the charismatic leadership has a positive path coefficient of 0.188 and 158 on job performance, with a significant value obtained of 0.026. All causal relationships in the model are proven to have a significant effect. This means that commitment plays a role as a mediator of the influence between charismatic leadership and job performance. Discussions. The findings of this study reveal that there is a positive and significant influence between charismatic leadership on job performance for health workers during the COVID-19 pandemic. Job performance cannot be separated from the role of the leader. Many factors can affect job performance, including competence, motivation, commitment, leadership, and other factors. This proves that charismatic leadership is proven to be able to stimulate the enthusiasm and motivation of their subordinate so that it can spur them to improve their performance. This means that if the charismatic leadership gets better the job, then job performance will increase. The conclusions. Charismatic leadership has a positive and significant effect on job performance for health workers. Charismatic leadership has a positive and significant impact on commitment to health workers. There is a direct, positive, and significant influence between charismatic leadership on job performance and commitment as a mediator for health workers during the COVID-19 pandemic. This study recommends that in the formulation of policies to increase job performance, it should be able to maintain and pay attention to charismatic leadership for future superiors because based on the result of the research show that charismatic leadership has a positive and significant effect on job performance. The study has limitation in terms of sample size and research location. Future research will need to expand the sample and conduct research in other areas so that the study can be more generalized. This is the reference. We only show 10 references uh, and actually it's up to 37. Thank you.